Aisha Neal, Program Director at BeWell at MPAC. Briefly, what does this program do?
This program takes individuals that have a skilled nursing home need and have a mental health diagnosis, or we like to say SMI, of schizophrenia, schizoaffective disorder, and place them on a unit in a nursing home. It allows them to get their skilled nursing home needs met with physical therapy, occupational support, or speech, as well as daily psychiatric needs met, which could include medication management, being seen by a psychiatrist, as well as activities on a unit geared towards their specific needs.
Aisha, we're going to explore some of those points in detail, but first, how can mental health care for seniors be different than mental health care for younger people?
For seniors, it's about their cognitive ability, and more so we do reminiscent activities and as well as cognitive stimulation. It's about engagement and keeping individuals active so that they can live the rest of their quality of life can be improved during their aging years.
Aisha, you said you do reminiscent activities there. Give me an example of what you're talking about.
So if you were born in 1955, name me your favorite song or tell me something that's happening during that year, or what was Christmas like for you during that time? Taking them back down memory lane.
And how much does that help with treatment overall, creating that environment?
It allows the individual to receive individualized therapy to really meet the person's needs at where they are and don't have expectations about what they're supposed to be doing. We try to capture what's important to the resident.
What forces came together that made this program possible?
It was a lot. It was a steering committee, starting with the state, Medicare, SAMHSA, the Ombudsman, OMSAS, the Department of Behavioral Health, advocacy groups, as well as different nursing home work groups, and CBH and various behavioral health providers came together to try to make this possible, as there seems to be very limited in regards to taking individuals across the Philadelphia system with SMI or severe mental illnesses.
A few minutes ago, Aisha, you mentioned a range of mental health problems that are addressed within this program. Now let's zero in on dementia and tell us, what is the technical definition of dementia and what happens to the aging brain that causes it?
I would like to get back to you on that. I don't know the specifics surrounding dementia specifically.
Well, then let's talk about, how about schizophrenia? You treat schizophrenia there too, and that's basically, I mean, to a layman like me, that's a detachment from reality in some way, right?
Yeah, so we often do not confront those type of delusions or paranoid thoughts. We try to introduce other things, such as we have a sensory room. We do distracting activities. We try to bring them back to reality based and have reality based conversations. We do tactile things. Tactile things are more or less things that they can touch in real time in that moment.
Now, I understand the efforts you're making there are unique, even pioneering. What is what you're doing there different than what's already out there?
Other than what a nursing home normally provides, a nursing home normally has traditional staff, and they provide about 3.5 patient care hours a day. We come in and provide an additional 5 hours of behavioral health supplemental service, which would include a one-to-one session weekly with the social worker, behavioral health nursing, life enrichment staff that provides engagement. They have a program director. We have behavioral health techs on a unit to address behaviors in real time. We also have a 24-hour psychiatric support from a psychiatrist.
Yeah, I was reading about that, Aisha, that you're able to staff psychiatric care and skilled nursing around the clock. So that must require a lot of planning.
It does. It does. So we like to keep it to staff and patient ratios, which are really important so that residents can get the individualized attention that they need and require.
Now, this is an important thing to get into, Aisha. We're talking about some good services that you're providing here. Who is permitted to take advantage of these mental health services? Is there some kind of screening process?
Yes, we do have a screening process. It starts with the Philadelphia Corporation for Aging. They they reference a person's current ability and medical ability and cross-reference it with nursing home requirements. For our particular program, eligibility of the program includes they have to be eligible for nursing home level care. They have to be required to carry a diagnosis of a SMI by a medical professional. They have to be Medicaid eligible, and they have to be a low harm risk to self and to others or property.
And I understand a skilled nurse has qualifications that other nurses don't have. And tell me what's the difference and how the skilled nurse comes into play within your program.
So the CNAs typically help support the members with things such as feeding, ambulatory needs, ADLs, which is activities of daily living, which can include bathing, dressing, helping them make their beds, and supporting them with just things that they want to do with their daily life. A lot of our individuals utilize wheelchairs and walkers.
As I was doing research for this, I was reading that the center operates without restraints for the patients. Now tell me, what does that do for the atmosphere of the program?
So we do not utilize any restraints. We are restraint-free, hands-off facility. So we really try to encompass their strengths, their values, as well as their weaknesses in their care planning. We do that through what we like to call case review, where we go through each case and we look at past history to see what has worked for the individual in the past. And then when a person is in crisis, we really try to hone on and utilize that. For example, if the social worker is their favorite person, then we have that social worker go kind of talk to them on that in that one-to-one space to try to de-escalate them to avoid a crisis.
Aisha, can a program like this help avoid more expensive treatment down the road? Tell us.
In the past, traditionally, a lot of our SMI or individuals with severe mental illness, they spent a lot of time in psychiatric hospitalizations, EACs, acute settings where they were there longer than what needed to be because there was not anything out there for them to anywhere for them to go. So with this program, it has helped save tremendously in regards to the capacity and open up beds and other places for more members to be serviced.
I know our viewers are wondering how much of the center's treatment is covered by insurance.
I would like to get back to you on that. I don't have the numbers, but most of our members are covered by Medicaid, and that's picked up through the nursing home. And then for the behavioral health insurance, that's supplemented by CVH.
And how big a program is it currently? In other words, about how many patients do you have right now?
We started in November of 2023. We started with 24 residents with the capacity to go to 48, and I'm happy to report at current we are at 47. And there will be a new site opening end of year called West at West Park.
I think this is an important question, Aisha. How do you measure success for your patients there?
We do evidence-based practices that are collected by data. And so we monitor, for example, as you just mentioned, escalation. We monitor where a resident came from, if they came from a hospital or an inpatient psych unit. We monitor falls, wounds, and so that we can see how successful and how well we're doing.
And I understand that the work you're doing there is, again, as I said earlier, that some are calling it pioneering, and they're calling it the Philadelphia model. So are there any plans to expand in Pennsylvania and apply what you've learned to other parts of the state?
Yes, we're calling it the Philadelphia model because we like to say we're the city of brotherly love, and we're so innovative when it comes to behavioral health services and needs. The idea of this program is working on a playbook that can be mimicked and scaled and used as a framework for other counties and other states. Because as you know, people are aging every day, particularly the SMI community. It's estimated that there will be, I think, about 12,000 in the next 10 years of members that could benefit. And that's just across Pennsylvania.
Last question, Aisha. I want to talk about you for a little bit. What attracted you to this type of work, and what kind of qualifications do you have?
Honestly, I started as a mental health worker. I always had the desire and want to help the community. Then I became a social worker. After social work, then I received my master's in clinical psychology, is my background. The benefit of what attracted me to do this work is, as I just indicated, I started as a social worker. So for me, the clients that I have seen throughout my career over the past 20 years are members who are now coming back to me in this program. So it has really been like a reunion for me. So that's been the most rewarding.
Aisha Neal, Program Director at BeWell at MPAC, thank you for your time.
Thank you.